We're away.
So welcome back to the Everyday Ultrasound channel. We're using ultrasound every day. We have our machine turned on in our GP clinic, and not every patient, nearly every patient comes in, you can find a reason to scan. Now we have Alex here who's got a good reason. He's got a shark bite to his foot, and he is unable to, if I show you his foot, his toe, he's unable to extend his middle toe, and you can see he's got a wound here. So we're suspecting a tendon injury, and we happen to have quite a decent scan, so we can look at the tendon. So we'll go to the screen, and you'll be able to see the screen fully. So you'll be able to see the tendons. Go back to the origin. So I'm going up the foot, and there's the extensor tendon complex. As we come down, you see them sort of splitting off, and there's the little toe one, which is the one we're interested in. See, we can follow it down quite easily. Comes down close to the bone. Oops. Because we're filming, we lose it. Hold on a tick, we'll see if we can find it again. There it is there. Sorry, that's it. So following it down. So we're coming down to close to the wound now, and see that's the normal tendon. See the hyperechoic looking tendon. As we come down, we're entering the wound area, gone. You can see, so basically we can identify exactly where the tendon is divided, and that's where we're going to make our repair, because we can't tell by looking at the skin exactly where that is. We know where the proximal end is. Just move your toes a wee bit there, Alex. Yeah, a little bit of movement. And we can go longitudinal on it, just sort of turning longitudinal on the tendon, sort of keeping it in the screen. There's the tendon there. Just move your toes a wee bit, yeah. And then we follow it distally. Just trying to keep it in there we go. And it stops. So you can see the normal sort of paintbrush appearance, and stops. Thank you. So very useful. Very useful little technique, and in our case we'll sort of make the surgery for repair of this tendon much easier, and we can find the distal end as well. Thanks, Alex.